Welcome back everyone, or welcome if you're new to the Aspect Health channel. Today we're talking all things glucose and PCOS, everything that you need to know to be able to manage your PCOS effectively. I am here with Dr. Basma Faris, our certified OBGYN. Hello Dr. Basma Faris, thank you so much for being here.
Hello.
So Dr. Basma Faris is our board certified OBGYN. She has over 20 years of experience in the healthcare industry. She is also a certified culinary medicine specialist and former registered dietitian. So with the help and expertise of both those two fields, she's really able to give a lot of insight how we're able to manage PCOS through lifestyle changes such as our diet. Just for the people that don't know who you are new to our channel, could you please just kind of give us a quick overview of your journey in the healthcare industry and what led you to be in the PCOS space?
So I started my career way back when I actually decided to study nutrition as an undergraduate at the University of California at Berkeley. And I went on to become a registered dietitian and get a master's in nutrition. And I was caring for adults and children, men and women, but oftentimes I would get referrals to see women who were either trying to lose weight or had pre-diabetes or early type 2 diabetes. And I noticed that many of them also had this diagnosis of polycystic ovarian syndrome, which at first I didn't know much about, but I noticed the patterns of this occurring together. And as when I decided to make a shift and go back to school to become a doctor, and I chose to specialize in OBGYN, I really started seeing it all the time. And I noticed that oftentimes people maybe knew they had PCOS, but they didn't know that there was any connection with their nutrition or any connection with the fact that either they had pre-diabetes or maybe that they had a lot of type 2 diabetes in their family, right. Or maybe that they, experienced a pregnancy where they had gestational diabetes, and people just weren't putting it together. This sort of really started my obsession, I would say, with PCOS, because I felt that I was in a position to really help people in a way that they weren't really getting elsewhere. So many people with PCOS, it's estimated maybe probably 70%, maybe more, of people with PCOS have what's called insulin resistance. And insulin resistance is a pre-diabetic condition, and it's a metabolic condition where people are unable to readily use the blood glucose as well as they should. Mm-hmm. And that impacts many different systems in their body, including their reproductive system. And so one of the keys to sort of managing PCOS symptoms is through managing blood sugar levels. That's really what we're going to talk about today.
Yeah, I think you absolutely wrapped it up perfectly. So in short, we can honestly make such a substantial difference in our PCOS through managing our blood sugar. And that's exactly what we're going to dive a little bit deeper in today. Starting with the basics, let's start from the very first step, like glucose. So the second we put food in our mouth and then our body decomposes it into glucose for energy, what is by definition, in simple terms, glucose and that whole process?
Yeah. So let's talk about what it is. Glucose is a sugar molecule in its most simple form, okay? It's called, in scientific terms, a monosaccharide. So it's one, if we think of like currency, right? Glucose being that currency. And many different foods, after they're digested in the body, right? We eat foods, complex carbohydrates. They're digested and broken down into their most simple form and absorbed as glucose. There are some other monosaccharides of interest like fructose and lactose, but most of them, even in our body converts them to glucose as sort of currency, okay? Energy currency in our bodies. And there's so many different carbohydrate sources, whether it's complex, whether it's simple, it ultimately gets broken down into glucose in order for it to be absorbed and enter into our bloodstream. So that has to happen first. And then it goes from our bloodstream into our blood circulation, where it's sensed by two organs, the liver and the pancreas. The pancreas is the endocrine organ that produces insulin and its counter-regulatory hormone glucagon. And insulin's job in our body, or one of the jobs, there's multiple, but one of its main functions is to signal to the cell to open up and allow the glucose to enter into the cell so that cell can use it for energy. When things work properly, the pancreas makes the right amount of insulin so that the cells in our body can uptake all of the glucose it needs, and cells are then able to function normally. But sometimes, as is the case in many people with PCOS, a few different things can happen. The cell, for whatever reason, is not listening to that signal from the insulin to open up. There's some miscommunication between the insulin and that cell. And so the glucose can't enter the cell as rapidly as it needs to, and therefore the cell can't work optimally because it doesn't have enough energy. The glucose stays higher in the blood than it should be, and the pancreas responds then by producing more insulin. So there's a few different things that are happening here that are not optimal or not normal. And that's really sort of the beginning or sort of the underlying cause of many of the symptoms of PCOS.
Right. So now touching a little bit deeper onto that. So we're starting kind of to see the problem form. Now, what is the effect of it with PCOS? How does those high insulin levels and high sugar in the blood affect the symptoms?
How do you feel when your cells don't get enough glucose?
Probably tired,
Pretty
fatigued.
tired, right? Fatigued, right? Your brain may not be like, you may not feel like you're really fully there, right? Fully alert. Right. You may feel really like fatigue in your body because your muscle cells are not getting the energy that they need. So fatigue is a big one, right? Both sort of mental fatigue, intellectual fatigue, right? You're like not as sharp, you're not firing, you're feeling kind of down. Yeah. Your mood maybe not so great. And then also that physical fatigue. Then the body's response to produce more insulin does a bunch of different things, right? It sends, insulin has many different functions. It doesn't just tell glucose to enter the cell or tell the cell to let glucose in. It also tells cells that they need to produce different enzymes, produce different proteins, and produce different hormones. And so sometimes when there's excess insulin, there are hormones that are then produced in excess. And so in this case, it could be that your ovary is producing too much testosterone as a result of too much insulin. It could be that the adrenal gland is producing too much adrenal androgens and other hormones like cortisol. Or it could be that your brain is producing too many hormones as well. It could be that your thyroid gland is getting enlarged. There's a lot of different structures in the body that can respond to the excess insulin, and that contributes to PCOS. Having too much sugar in the blood also does thing in that it binds to structures in our body. It binds to proteins and forms these complexes called advanced glycation end products that we now know cause havoc all throughout the body, in your arteries, in your heart, and can also disrupt different important processes in the body. So there's many, many different ways in which this problem that we call insulin resistance is impacting many different organ systems in people with PCOS.
So now that we know the problem of how it's arising and then kind of the whole process of it affecting various different areas in our body and it influencing our symptoms, how can we manage these high levels of insulin as well as these high blood sugar levels? So
I like to think of it really at two sides of a coin. And so one is sort of what we're letting into the body, right? Mm-hmm. And how much glucose is getting into our bloodstream from our digestive tract. And so that is managed many different ways by the type of foods that we consume, the type of carbohydrates that we consume, the amount that we consume, right, the other foods that are consumed in a meal. All of these things can impact the amount of glucose that enters the bloodstream. People think that if you have PCOS, you can't have carbohydrates, which is absurd, right? It's that you have to figure out for yourself What is the right portion? What other foods can you eat with your meal to sort of slow that down? Because you need glucose. We all need glucose. We need glucose for energy, but we want it to enter from our intestines into our bloodstream slowly so that our pancreas doesn't need to overproduce insulin. And so our cells can respond, even if it's a little bit more slowly, but can respond appropriately. The other side is, how can we improve insulin sensitivity on the cellular side? And we can do that by reducing chronic inflammation, by certain nutrients in our diet, and how we move our bodies. And so that can help on the insulin sensitivity side. So we really want to be sort of using all of the tools that we have at our disposal. And we want to also get, real-time feedback, which we're going to talk about in a minute. So we know what is working for us, right? Because each of us is unique, and what works for one person is not going to work for somebody else.
Let's say a person is now ready to take a handle of their blood sugar levels. What are some tools that they can use to be able to fine-tune their diet, see what portion sizes work best for them, what type of carbs work best for them in foods?
Number one, kind of educate yourself on what foods potentially could be problematic. Number two, I would say get some help, right? Don't go it alone.
Yeah.
Find somebody who's knowledgeable, find some reliable sources of information. And then three, use a continuous glucose monitor. This is a tool. It's a personalized health tool that can allow you to learn for yourself what it is that you need and what foods work for you in what combinations and in what portions, and how long is the ideal interval that you should wait between meals, because some people it may be longer, some people it may be shorter, and something like a continuous glucose monitor can really help you to do that. And I use them increasingly with my patients in my PCOS practice.
So if a person has decided to use a continuous glucose monitor to be able to personalize their diet and see the type of foods that they eat and factors in their life that is contributing to these high blood sugar levels, if they were to look at it on a graph, what should they avoid? So do we want the stable ones? Is it okay if there's a little bit of a spike?
So it's interesting. Everybody's a little bit different. I have some patients who their blood glucose, if they don't eat or when they wake up in the morning, are stable, and they eat and they just sort of have these big fluctuations after meals. I have other patients who don't have big fluctuations, but overall their kind of average glucose is on the higher side. Mm-hmm. I have other patients who, after they eat, have really big dips after meals.
Yeah.
So everybody's going to be a little bit different, but knowing what to look for is really important. And so you really need, a CGM requires a certain amount of education and understanding of what it is that you're looking for in order for it to be useful.
Yeah.
It also gives a lot of information, right? It gives you information all throughout the day. What I like to look at, what's called fasting glucose. What is it like when you wake up in the morning after not eating all night? What does your glucose look like after you eat, within 1 to 2 hours after eating? And what does it look like beyond that, 2 to 4 hours? Where does it settle out after that? Is it coming down? Is it taking a really long time to come back down to normal? Or like I said, is it going lower than when you started before your meal? Mm-hmm. These are all really important things to know, because they're going to tell you about how your body is able to utilize the food that you eat. And also, what is sort of the optimal amount for you to wait between meals? So these are the things that I really want to know. What is it, sort of the average overall? What is it like in the morning? What does it look like after you eat? What does it look like in between meals? And what is it also when you're maybe feeling different ways, right? Mm-hmm. So let's say you're feeling like your heart is racing and you're feeling kind of anxious.
Yeah.
What is that? What is your glucose doing at that time?
Right.
Are you feeling that way because your blood sugar is a little bit low, and that's making you feel kind of anxious and making you feel like you need to eat something? Are you feeling dizzy, right? And so some of the symptoms, the sort of vague symptoms that occur with PCOS, oftentimes are related to the blood sugar.
What sort of meal should we be eating? How much protein, how much carbohydrates, healthy fats, etc., so that our glucose levels are within optimal range? Of course, that's going to vary for everybody, but just kind of like a guideline of what meals would spike our glucose levels, what meals would help it keep it better.
Balance is really important in a meal. Everybody's protein need is going to be slightly different depending on their size, right? And the goal is to maintain or increase your lean body mass. Right. Protein in a meal also helps you to feel more satiated, right? Helps you to feel like you ate enough. And also protein in your meal, like protein generally doesn't stimulate the pancreas compared to carbohydrates. You need carbohydrates for energy. But you want carbohydrates that are going to digest a bit more slowly. So trying to find higher fiber carbohydrates like a whole grain or, something like a lentil or a bean, starchy vegetables that have fiber in them are going to provide you the energy that you need. But because they're digested more slowly, they're going to enter the bloodstream more slowly. Does that mean you can't ever have a starchy food like white rice, right? It's a question I get often because some people really just love white rice. It's an important part of their cultural foods. Yeah. Absolutely. You can figure out how. You have to combine it with other foods, right? So adding fiber to that meal and adding some protein to that meal is going to make it a better choice than just eating that food alone. Having a little bit of, essential fats, like if you're eating a fatty fish or a little bit of dressing that has a little bit of fat in it is also going to help you feel full. It's also going to slow down movement of food from the stomach into the intestine. And so that's really the strategy. We don't want big ups and downs. We kind of want a little bit more of a steady stream, so to speak.
How does exercise play a role? And also mentioning about the two sides of the coin, how does that help with the insulin sensitivity, like the long-term effects?
So in our muscle cells, there are these gates. They're called GLUT4. These are these sort of gates that open up and allow glucose to enter from the bloodstream into the cell. When insulin binds to the cell, to its receptor, it actually tells the cell to basically bring those gates to the cell membrane and open up and allow the glucose into the cell. Movement, exercise does the same thing, even if insulin is not present. So one sort of way of getting around not having adequate insulin or to sort of help the body if there's, some insulin resistance is movement. So that's what oftentimes there's a recommendation to take a walk after you eat because moving the muscles helps to open those channels and allow the glucose into the cell. So that's what occurs in the short term. Exercise in the long term does a few different things. It actually promotes the production of more of these gates, these GLUT4 proteins. So the body produces more of them. And the more that you have available on the surface of the cells, the better insulin sensitivity the cells have. And then lastly, the more muscle mass you actually have, well, then that's just going to maximize that effect, right? It's going to increase that effect across the board because the more muscle cells you have, then the more that insulin sensitivity can improve.
Of course, there's a lot of information, especially on social media, the different types of exercise recommended for PCOS. Yeah. I know with our previous conversation before, you mentioned that, of course, there's benefits to both cardio as well as strength training. But let's say I notice that, for instance, cardio such as running increases my cortisol levels. Does that mean that exercise I should do less of, or should we still kind of stick to both cardio and strength training when exercising?
What happens is if you exercise and you utilize all your stored glucose, or you exercise and your blood sugar drops, your body has a mechanism to counterbalance that. And it releases what are called counter-regulatory hormones. One of them is glucagon, which comes from the pancreas, And then another one is cortisol, which comes from the adrenal glands. And that the job is to bring the blood glucose back up. So if you use all your glucose that's stored in your muscle and your blood sugar gets a little bit low, that's what's going to happen. Okay. Your body is going to produce these hormones to maintain your blood sugar so it doesn't go low.
Yeah.
Unfortunately, the adrenal glands, because they produce cortisol, they also produce androgens, the precursors to testosterone. And unfortunately, it's not that adrenal glands aren't always so selective. So in the process of them sort of turning on and producing more cortisol, they also at the same time can sometimes produce more of the adrenal androgens. And then now you've got more androgens circulating, which we know is not good for PCOS. And so noticing, right, if you do a particular type of exercise and you go beyond a certain duration, perhaps, you're getting, maybe you might see your blood glucose kind of dip and then jump back up.
Yeah.
That's usually because your counter-regulatory hormones are kicking in. And so you have to make sure maybe that you eat a little bit before a workout, right? And so you're going to have to play around with how you fuel your exercise. Everybody's a little bit different. And so I know there's a lot of information out there about what type of workout is best. I don't agree that there's sort of one way of working out or there's something that you should avoid. But sometimes you have to adjust how you fuel your body for exercise. You also have to do things that bring you joy, right? And that don't make you unhappy. So don't do exercise that you hate.
For sure. I like what you said even before in one of our videos, like the simpler, the better. I think a lot of people kind of overcomplicate it. That exercise has to be this, big routine that we have already set up, but even as simple as like dancing around just to get your heart rate up also counts. Now we're kind of slowly transitioning towards the end of our video. So I wanted to spend the next 5 minutes discussing the PCOS program by aspect. So we mentioned throughout this whole video the importance of glucose and how managing your blood sugar levels can really help improve PCOS, given that the majority of women struggle with insulin resistance. And one way, the leading way to manage that insulin is through managing your blood sugar levels. So not only does Aspect send you a continuous glucose monitor, you also get paired with a personal health coach that will guide you every single step of the way so that you can have sense of this data. You don't have to navigate it by yourself. There's an expert that is knowledgeable about these things that will be leading you and also helping you create tailored health plans based on your body's data, which is really incredible and super personalized. Here is actually an image of Christina, one of our health coaches, and you have one-on-one health coaching. You have video consultations. You're more than welcome to message your coach anytime in the in-app, in the chat box. Any questions you may have, any suggestions, you can feel free to reach out to them, which is really incredible. I think a lot of the women here with us today, watching this video and watching this video in the future, would love to hear your thoughts and opinions on the Ask PCOS program coming from your medical expertise, helping women with PCOS every single day. What benefit do you think this program can have for women with PCOS?
What I love about the program is that it's a lot of work to take all of this information and interpret it and then turn around and make individualized recommendations. And so this is what I do for my patients. And to have a resource that anybody can access, I think is just so useful. I think it's such a great option for people because it's complicated. And so just having that feedback, having those experiments that you can do to figure out what works for you, having the coaches that help you to interpret the data and look at the patterns so you can really see what, if you're unable to figure it out for yourself, I think that's incredible. Also, having all of that reliable health information. There's so much misinformation out there. So like having a resource where you could go and really trust the information that you're getting, I think is so valuable. So for all of those reasons, I love the Aspect PCOS program and the app.
Yeah, absolutely. Thank you for sharing with us your thoughts. I think a lot of people, especially with PCOS, of course, have a hard time finding reliable information out there. So this is definitely one way of going about it. The link for the PCOS quiz will be in the description for you to check it out. It's absolutely free and it won't take much of your time, but it can give you a lot of insight into the aspects approach and just kind of give you a little bit more telling into whether this program would be the right fit for you. Looks like we're coming towards an end to this episode of Glucose and PCOS. Dr. Basma, thank you so much for being with us here today and explaining to us all these valuable, important things that I think every woman with PCOS should definitely be aware of. So thank you for your time, and I definitely think a lot of women out there looking for reliable source of information appreciate you being here as well.
Thank you, Alicia. As usual, it's my pleasure.
If you liked today's videos, definitely like and comment, as we'll be producing more reliable content for you. You can suggest any other topics for us to film. Any questions that you wish for Dr. Basma to answer, you can drop them in the comment section below. And that is all for today's video. Thank you for watching, and we'll see you next time.